Welcome everyone. My name is Gabby Guastalli, the project coordinator for the Pledge for Life Partnership.
And I'm Garth Reynolds, the executive director of the Illinois Pharmacists Association. The objectives of this webinar are to share who the Pledge for Life Partnership is, to review local data and harms associated with prescription drug misuse, help you become aware of the prescription drug abuse prevention efforts happening in Kankakee County, and introduce ways that you can become more involved in these efforts.
So I just wanted to share a little background about the Pledge for Life Partnership. Our mission is to coordinate resources to improve the quality of life for children and their families by making the community safer and healthier. We focus on initiatives to reduce substance abuse in Kankakee and Iroquois County. Using data collected from the Illinois Youth Survey and local focus groups, we have identified 3 substances that we would like to focus our prevention efforts on. And those are underage drinking, youth marijuana use, and youth prescription drug misuse.
During the past 6 years, the percentage of teens who report using prescription drugs that were not prescribed to them has nearly doubled. Between 2012 and 2014, there was a dramatic increase at every grade level covered by the Illinois Youth Survey. Among 8th and 10th graders, prescription drug abuse during the past year approached the levels of cigarette use. For 8th graders, these rates were 8% for cigarettes and 7% for prescription drugs. And for 10th graders, they were 13% and 11% respectively. This trend is alarming in the light of a heroin crisis in the community involving young adults and the high number of these heroin users in prescription drugs in high school. Nearly 1/4 of all 8th graders and more than 1/3 of all 10th and 12th graders perceive it to be easy to obtain prescription drugs that have not been prescribed for them. 58% of 8th graders who indicate that they have used prescription drugs not prescribed to them say the drugs were given to them by their parents. Nearly half of 10th and 12th graders who indicated that they have used prescription drugs not prescribed to them had been given or purchased these drugs by someone other than their parents. Among those who indicate they have used prescription drugs not prescribed to them, twice as many youth say the drugs have been taken, stolen from home, rather than from someone else's home.
So in July of this year, the partnership was honored to receive a Cardinal Health Foundation's Generation RX grant. The partnership was one of 25 grant recipients in the nation and received the maximum requested amount of $25,000. The Generation RX grant funds organizations with the aim to educate people of all ages about prescription drug misuse prevention through these simple key messages. 1, take medication exactly as prescribed. 2, store prescription drugs in locked and secure locations. 3, properly dispose of medications that are no longer needed. And 4, promote safe medication practices and teach others to do the same. So recently we have formed a prescription drug abuse prevention work group, which has included members from law enforcement, pharmacists, health department, schools, youth-serving organizations, and treatment providers. Although participation from many sectors of the community are necessary to make the educational and awareness campaign successful, youth and pharmacists play a significant role in the dissemination of this project. A youth advisory council was also recently formed with students from 9 of the local high schools in the county. They have been learning about prescription drug safety and disposal and how they can take the information back to their schools, peers, and community. They also have been working on projects such as a film challenge, billboard contest, and radio PSA contest to promote the 4 key messages to share in the community. The youth actually created the logo design, name, and tagline for this project. This is a logo. So you will start seeing this around the community on billboards, brochures, and flyers. This project has been named the Kankakee County Prescription for Prevention Project.
We feel that pharmacists play a vital role in the prevention of youth prescription drug abuse. Pharmacists are trusted healthcare professionals, medication safety experts, community leaders, and advocates for community wellness. You are key to the disposal program awareness, promotion, and education efforts. We invite you to become involved with this project because of the key role you play in educating our community about how to use their medications safely. We need your help with these following efforts. 1. Assist by displaying disposal location flyers and medicine safety information in your waiting areas in your practice. 2. Make a donation of $25 or more to assist with efforts to execute the community education plan for youth prescription drug abuse prevention. And 3. If you'd like to become even more involved, join our prescription drug abuse prevention work group. There are a number of ways you can become involved through this group.
If you're interested in helping, have other ideas in the area of prevention, or any questions, please reach out to us. We thank you for your time to watching this webinar and hope that you have learned a little bit more about the local issue and how you can help us make our area a safer and healthier place to live. Thank you.